Hello and welcome to another edition of Hypnosis Helps with me, Neil Myers, hypnosis practitioner. And I'm going to just do a slight technical thing here. It's not very technical. I'm just going to ask the studio, because our wonderful controller back there, MJ. MJ, there are several microphones here. I just want to make sure that I can be heard. Can I be heard?
Yes, but you picked up the one on the back of your chair, which was the correct one. You're good.
Good. All right. Thank you. It's live TV, folks. So you see, and it's unedited. So if I don't find these things out, it'll all be wasted. Anyway, welcome back to another edition of Hypnosis Helps with me, Neil Myers, hypnosis practitioner. As I put away my phones, that however many times I try to turn them off, somehow don't want to go off, and they always ring on the air. But anyway, welcome back. This is part 3 of a topic which I'm very, very passionate about, and that's hypnosis in relation to improving fertility. And I'm very passionate about it because I think it's one of the areas of hypnosis that it's shocking to me that it's so little known about. It's shocking that it's so little known about, not because of its effectiveness in improving the chances of healthy men and women having a child, or of course healthy women having a child, with the aid of men, a little bit. And but also because it's so much more powerful and effective than so many other methods of fertility treatment. At the end of the last show, just to remind you, we looked at a huge study that was done by the CDC, Centre for Disease Control, here in the United States, and it's quoted in this book, which, as I've mentioned before, is a helpful book. It has a big weakness in it, which I'm going to cover more today, what that weakness is. But just as a reminder, as I flick through this book, just to make sure that the figures are correct, the typical success rates for in vitro fertilization are only at 28%. And that's heavily skewed by the fact that in this large study involving 94,242 women looking at live births, then the sample was skewed towards younger women who enjoy a higher rate of success with in vitro fertilization. If you're above 40, then your chances of success with IVF fall to single digits, very, very low. And the cost of each cycle, well, this book quotes at the time 12 to 25,000. These days, that's closer to 15 to 30,000 per cycle, depending upon where you go and exactly what type of procedure you have. They're not all completely standardized. And how many cycles would you need to go through? Well, the reports are it's not infrequent for women to go through 7 cycles before either becoming pregnant, if they fall within that percentile, or basically giving up. So not only is it a procedure which has a low percentage likelihood of success, even for younger women, but is extremely expensive and usually not covered by any form of insurance. So, once again, coffee sustains the hypnotist. So folks, I've saved the best for last, because today I'm going to talk about 2 things. I'm going to talk about what I believe to be, and for reasons that I'm about to give, the most important and significant experiment that was ever done on hypnosis and fertility. And contrary to what Mr. James Schwartz asserts or reports in his book, this was not from the 1970s, the 1980s, the 1990s, or any part beyond that. The most significant experiment as far as body-mind and hypnosis specifically was actually done in 1952. And this is well explained and well detailed in the works of Dave Ellman. Now, one of the things about Mr. Schwartz's book and others is that he, like many hypnosis practitioners today, unfortunately, seems either to be unaware of the existence of Dave Ellman, which I find a little bit strange because almost every hypnosis practitioner knows about Dave Ellman, or just doesn't want to say anything about Dave Ellman's work. Or he's just completely unfamiliar with not only the writings, but even more importantly, the recordings of Dave Ellman teaching and describing his teachings. Now, one of the things I want to point out, and you've heard me point out about Ellman, and everything that you're going to hear about this from this experiment, is Dave Ellman working with doctors. From sometime in the 1950s through until his death in 1962, Dave Ellman, along with his wife, Pauline Ellman, they worked together, as you'll hear, taught only doctors. He didn't teach people for the stage, he didn't teach people for entertainment. There was really hardly any such thing at that time as people like myself, separate hypnosis practitioners. So everything that you're going to hear about now is to do with him teaching doctors. And he taught doctors nationally for pushing 20 years. And his students numbered in the thousands. And at the time, these doctors, as in a similar way to doctors today, were seeing daily dozens of patients, weekly probably hundreds of patients. And many of them were using hypnosis constantly. So we're talking about a group of people not only trained by Dave Ellman, which we're going to talk about, but using his methodologies, these powerful methodologies, right across the country in all manner of cases and circumstances. So I'm going to be referring to my notes quite extensively here, so I haven't found hypnosis effective for myopia yet, but or the opposite, I need them for reading. So it starts just in 1952, as Ellman tells the story, when he's approached by doctors, his students, and they've previously been using hypnosis to deal with, heal if you will, or change, what is very much a 1950s, 40s and 50s term which you don't hear much anymore, which is hypnosis in connection with frigidity. And hypnosis, which was almost invariably, it was only applied to women, that term, and how it's defined varies, but it seemed to be indicating a lack of interest in sex, or male impotence. And again, today we talk about erectile dysfunction, but they were a little bit more direct in those days, and they talked not only about erectile dysfunction, but impotence, which they kind of used almost, it was assumed that there'd be erectile dysfunction if there was impotence. And what they discovered on Dave Ellman's courses and in their own practices is that hypnosis was very, very effective for both of these problems because they have an emotional base. So they approached Dave Ellman and said, well, if it can be used for that, perhaps we can use hypnosis to help with sterility and infertility. Again, they tended to use the word sterility then. We tend to use the word infertility now. People seem to think sterility is a harsher description, but there it is. And when they approached Dave Ellman, he said, honestly speaking, I've never heard of hypnosis being used for such a thing. I don't know if it can be used. I don't know if it's effective. And this is typical of Dave Ellman. He never likes to overplay his hand. He's very, very straightforward with the doctors. It's important for him for his own integrity and his personal reputation. But they weren't so easily put off because the doctors enthusiastically revealed that their own studies show, and I'm going to quote here, that, and this is studies conducted in the 1940s and 50s, and they don't refer to the specific studies, but we're going to take them at their word. No reason to believe that they're lying about this. Studies reveal that 20% of couples who adopt conceive and have their own children within a 2-year time period. And therefore, they reason that perhaps a high percentage of sterility in the absence of any organic factors, has an emotional cause. And if it has an emotional cause, they reason hypnosis should be able to help. And Dave Ellman doesn't disagree with them. Now, I want to point out something that's very interesting here right at the beginning for me. For all the cases that I talked about before and all the studies, they look at sterility as firstly a female problem. I know obviously there are elements of male impotence that can affect it, but it's largely viewed today with assisted reproductive therapies, and the overview is essentially a female problem only. And the second thing is it's viewed more as a chemical, mechanical body problem. But these doctors at this time, and the outlook at this time, didn't view it in that way. They viewed, in the absence of organic causes, sterility and infertility as essentially a sexual problem. That's why they see the link between that and hypnosis. And because it's a sexual problem, they see it also as having an emotional basis. And since these doctors are using fairly straightforward direct suggestion hypnosis as taught by Dave Ellman to heal simple emotional things. When I say simple, if they run into blocks or difficulties, their default practice is to refer the person to a psychiatrist because the problem is beyond the ken, beyond the skill of the specific doctor, who is then normally a family doctor, an internist, a general practitioner, not a specialist. In fact, at this time, I don't even believe there was such a thing as fertility or infertility specialists. There were certainly doctors that had more interest in it than others, and later on we'll hear a report from a society, but those type of specialties didn't exist. So this is a problem that family doctors would be running into on a fairly frequent basis, as they did with many, many other things. So, just I was a sidebar about psychiatrists. When we think of psychiatrists today, or actually when the general public think of psychiatrists, they still think that a psychiatrist tends to practice in the same way as a psychiatrist did, you know, in the movies that you might see, or 40 or 50 years ago. You go in there and they sit down with you and have long conversations. But the truth of the matter is medical practice hasn't been like that for psychiatry for a long time. Basically, these days, psychiatrists see you very, very briefly and then quickly determine if you need a medication and prescribe it. If they determine that you need further talk therapy, very, very rarely do the psychiatrists themselves do that. They'll refer you on to counsellors, either who are part of their practice or who they work with, of different types and different varieties, but they themselves don't really do any counselling actively. They mostly prescribe drugs these days, drugs that are aimed at affecting mood, emotion, and other things connected with the brain and the mind. And so when Ellman and these doctors talk about psychiatrists, they're really talking more about counsellors as we would understand them today, or that's the sort of work that they were doing. So Ellman's sceptical, to his credit, about whether hypnosis can be used in this way, but the doctors are enthusiastic. And two doctors particularly are enthusiastic. And so they begin an initial experiment. Now I'm going to describe the protocol that they used in a moment. But here's what the initial experiment looked like. They took a group of 20 couples, right? 10 in one control group, 10 couples, and 10 in another control group. So in total, we're looking at 40 men and women. Now again, at the time, there wouldn't have been any idea of conception occurring outside of marriage. Of course, conception and pregnancy, of course, like in any other age, occurred out of marriage, but at the time it wasn't considered proper or decent, and the doctor wouldn't have anything to do with that. So all of these ladies and gentlemen are married couples. And that's the social context of this whole experiment. And remember, hypnosis exists in a social context. So they're divided into two groups. The experimental group, in which they're going to use a hypnotic protocol, and a control group to try and determine the effectiveness, if it has any, of the hypnotic protocol. Now, before I give you the details of the protocol and the results, I just want to say one thing that I think is extremely important here. On the previous show and the show before that, I mentioned that one of the problems I have with hypnotic studies generally, and even some of the ones that I've quoted and other studies, is that we don't exactly know the type of hypnosis and what was done, unless it's described in details in the study. And to make matters even worse, we usually don't know how skilled the hypnosis practitioners were. There's a general assumption that if they've been trained, they're all of a certain skill level. But this, of course, is absurd, as I mentioned before, because hypnosis isn't like a drug or a pill where you just give it and administer it. It's a skill set. And like surgery is a skill set. And some surgeons are more skilled than others, and some hypnosis practitioners are going to be more skilled than others. And similar to surgery, not everybody's using exactly the same technique all the time, even when procedures are quite similar. But here we have an improvement upon that general outlook in this way. All of these people have been trained by Dave Ellman. All of these doctors are people who have been trained, rigorously trained and tested by Dave Ellman and his wife, Pauline Ellman, who assisted him in the teaching. Some of them say that Pauline Ellman was a better teacher than Dave Ellman, so there you go. And so their technique was good, because Dave Ellman wouldn't let people through his course unless he could see that they could meet a certain standard. So here we have, in some ways, just from that perspective alone, one of the most objective tests of the efficacy of hypnosis in the Ellman style. And I have to say that hypnosis in the Ellman style is what I would describe as true hypnosis. We're not talking about creative suggestions or creative visualization. We're not talking about light states of hypnosis. Ellman insisted that him and his students bring their clients, doctors, patients, into true somnambulism by test. He has a way of determining that. Ellman's definition of hypnosis, as you've heard me mention before, is the bypass of the critical faculty and the omission of acceptable selective thinking. And there are tests for the threshold of somnambulism and somnambulism. He wants them in that somnambulistic state before he even considers giving suggestions. So one of the things we know about this is all of these hypnosis practitioners, the doctors, were able to bring people into a somnambulistic state. They were good at these procedures. Now, the procedures that I'm going to describe and their protocols are by far from complicated, difficult, or involved. They're actually very simple, very simple. But these people are very well trained, so that's a very important point. So we've got a consistency there that we don't see through other studies. Now, let's get back to the group. We've got 10 couples in one group, 10 couples in the other group. And what happens? Well, they measure it over the course of, Ellman doesn't say specifically, but it's less than a year. In some instances, as you're going to find out, a lot less than a year. In the control group, those received nothing at all, 2 became pregnant. So even if nothing happens at all, 2 are going to get pregnant, 20%. Actually, that's only about 8% worse than in vitro fertilization if you do nothing at all, by the measure of the CDC. So it's got to make you ask, how effective is in vitro fertilization when you look at just a control group here? I don't know. That's a separate question. But 8 out of those 10 couples in the experimental group became pregnant and gave a live birth. And now, by the way, it's always assumed when Ellman talks about pregnancy that this is going to lead to a live birth. He's not just talking about a pregnancy which might last a week or 2 or whatever. He's talking about live birth. 8 out of 10. 80%. Now, if you remember some of the studies that I quoted to you before, that completely eclipses anything that I'm aware of that's been done through the 70s, 80s, 90s, whether they're using hypnosis in the term that some people describe it. I don't know whether it was real hypnosis. It may or may not have been. Whether they were using an extended form, as we've seen in the other studies, of talk therapy in the form of cognitive behavioural therapy, or relaxation, or stress reduction techniques. It completely blows all of those things out of the water. And this was done in 1952. And therefore I find it really surprising that Mr. Schwartz, who seems to be a genuine chap, and has written, as I say, in many ways an excellent book, doesn't refer to this at all. The information that I'm giving to you now seems to be now almost unknown or not talked about. So what you're hearing is rare information, and if you or somebody you know, a friend or a loved one, are looking to have a baby, pay real attention to what's happening here, because this can be absolutely key for you. So these results were so dramatic that when the results came in, as it were, Ellman reports that he spent 3 days contacting all of his students across the country, doctors, suggesting to them that they adopt this procedure. And they did. Now, again, a sidebar. This was the way for decades and decades and decades that medical knowledge was passed on. And it's still similar, as I described last time, to the way medical knowledge and procedure is passed on in surgery. Of course, these days, if Ellman had been alive, he'd have had to go along to somewhere to get a grant from some institution. There'd be no commercial interest in it because there's nothing patentable here. He'd have then had to spend ages going out and trying to find groups of people to do a study, and goodness knows whether that would have led to. And if you look at the modern studies that I quoted, even with these very serious people and practitioners, they involve relatively small numbers of people, with the exception of the overall analysis done by the CDC, which involves the whole country, but small numbers of people. But here, although Ellman doesn't quote the numbers, we have to believe, inferring from the numbers of people that he taught, the numbers of women who are coming to see just their regular doctor for infertility issues, women and their partners, that these protocols that I'm about to describe were conducted by thousands of doctors, possibly for tens of thousands of their patients. Even if we assume that only, let's say, 30% of Ellman's students actually did this, we're still looking, based upon the numbers of the people that he taught from 1952 until 1962, which numbers in the thousands, the doctors, that there's probably a few thousand doctors across the country doing this. So what I'm describing here constitutes by far the largest experiment ever conducted with hypnosis in regards to fertility, infertility, sterility. By far. There isn't even anything close to it. And yet, it's been largely ignored. So here we have this extraordinary result. Now, what happens when this protocol is taken out to them at large? Well, guess what? They find that following this protocol, they get just about exactly the same results. In other words, approximately 80% of the couples where there is no organic cause for infertility, the woman becomes pregnant and they give birth to a healthy child. An extraordinary result. Now, what's the protocol? That's what you're all dying to hear, right? And I'm going to describe the protocol that Ellman uses, and I'm going to describe why the protocol which I'm suggesting may be an improvement, well, not maybe, I believe it is an improvement for very specific reasons that we're going to talk about. But let's have a look at the protocol that Ellman's using. So the first thing that they want to know is that the woman is ovulating. Obviously, if the woman is not ovulating, then it's going to make things pretty hard. So that's standard knowledge. Nothing new there for those of you that are attempting to have a baby. But how did they do it? Well, they didn't have the tools that we have now. So basically, it was just based upon a temperature and a chart between the two menstrual cycles. That was it. So it wasn't a bad guess. Temperature is still used as an indicator, but it wasn't absolutely flawless. These days, you can go and purchase an ovulation kit, which is fairly accurate. I just read about something, and this is not an advertisement for it, but it's something, and I'm sure there are others, called the OvaQ Fertility Monitor. Fertility monitor that you can purchase for under $250. That uses measures of, I think, saliva, not even urine tests and other things very accurately to measure ovulation. So in that instance, we can improve. We can be much, much, much more accurate than Ellman was. But even with a degree of accuracy in 1952, they're still getting results that eclipse anything that we're looking at today. With all the involved and complicated techniques, they're blowing them out of the water. So, what do? Well, the first thing, remember, this is viewed as a sexual problem in 1952 only. The first thing is that the couples are kept, and he doesn't exactly say why, but they're kept separated. And I guess by separated, they mean that they're encouraging them not to have sex, at least until these procedures. How long they were kept separated for, I don't know, but I don't think for a long period of time, possibly a few days. And they keep them separated until by the temperature measurements and by the chart, they believe that the woman is ovulating. And at the time of ovulation, they take both the man and the woman. Again, every study that I've quoted and everything I've seen just focuses on the woman, but they're focusing on both. Okay? Now, again, a little sidebar. You might say, well, you know, if the man is potent, is producing enough semen, why is that even an issue? And again, it's back to the idea that it's only mechanical. I actually think that their outlook is much more enlightened and sophisticated than our current outlook, which is crude by comparison. They're basically saying, look, we don't exactly know what's going on, but we know there's something happening emotionally. We know it's happening emotionally because we're inferring it from the fact that couples who adopt, a percentage of them become pregnant. We're inferring that. And we don't know exactly whether that's an emotional effect created in the woman's body or the man's body or when they come together. So I even bothered to figure it out. Let's just do both. Let's cover both. And I think that's a very, very sensible approach. And for any of you that are looking at a fertility program involving hypnosis, and goodness knows there are so few out there currently, they're hard to find. Any hypnosis program that doesn't include the man, where there is a man, I think is limiting itself, and the statistics bear that out because none of the current protocols have anything like this degree of success. So, the next thing at the time of ovulation, they bring the couples in and they put both of them into a somnambulistic state, the state where suggestions, apart from something that I'm going to mention in a short while, are most likely to be accepted. And again, we know the quality of the hypnosis because we know that Dave Ellman wouldn't have not allowed his students to understand how to bring somebody into a somnambulistic state and test it. He was rigorous about it. And in that somnambulistic state, the woman is told, and I quote, "This night you will be very desirous of your husband sexually." Now, it may seem almost comical to us, but believe me, this is serious stuff for the couples involved. These are couples, just like the people watching this, who want to have a baby. It's what they want most in the world. So this night you will be very desirous of your husband sexually. Okay? Now I'm sure there was a little more to the hypnosis than that, but that's essentially it. That was the key message. And the man is told, in somnambulism, now bear in mind this is in the 1950s, so it's 52 words I'm going to quote here, and I quote, "You will have the potency of a 15-year-old boy." Now, given the general attitudes towards sexual mores and political correctness, I personally do not use the term the potency of a 15-year-old boy because who knows what that's going to run into these days. But in 1952, that was acceptable verbiage. Now again, the point isn't that we have the politically correct phrase for the age. As I've said many times, hypnosis exists in social context. The important point is they're saying to the woman, you're sexually desirous of your husband, and to the man, you're potent and sexually desirous of your partner. So they're really reinforcing that. And then it says that they are sent home. And of course, in 1952 style, we have to guess at what sent home means, but let's be direct, let's not be coy. It means they're going home to have sex. And my guess is they probably had sex that night, the next night, the following night, at least 3 or 4 nights. Again, he doesn't specify, but it doesn't matter, right? And that process that I just described, you wait, you measure the time of ovulation, you bring them in. Now again, it doesn't say if there was a period of separation. It might have been the view was that a man would be even more potent if there was a period of separation. I don't know. I doubt whether that's really the case, but let's just leave that as it is. But at the time of ovulation, they were brought in, both in somnambulism, both given those suggestions. And that was done for a period of 3 successive months. And just that simple protocol alone, when accompanied by well-constructed, powerful hypnosis at the right time, results in 80% of the experimental group, and more in some instances, as you're going to learn, 80% plus conceiving, woman becomes pregnant, and they have a healthy child. An extraordinary result for such an extraordinarily simple procedure. And sometimes, as I look at these old studies, I sometimes think, I really do wonder, have we improved things or have we made things worse? Are we too clever for our own good these days? Have we got so many bells and whistles and devices and studies and measurements that we're actually ineffective because their results are more effective than our results? Or at least, you know, the results of the overall ART, assistive reproductive therapies. Now, I want to make it really clear that these doctors were not full-time hypnosis practitioners, and they're not using any of what Ellman would call hypnoanalysis, trying to get to the root cause of things, as you heard me described as healing hypnosis by regression to cause. They're not using any of that at all. That's all they're doing. Now, what do these doctors do? Well, they have local OB-GYN, OB-GYN groups. They introduce it to the groups. So here it's spreading. And again, this is how medical knowledge spread. A doctor tries something out and says, you know, I've tried this, it seems to be effective. Why don't you, my colleague, try it? Let me describe it. And it spreads, and this is how it becomes known. And again, what that means practically is there are hundreds, possibly thousands of doctors using this for a period of time. And one of those doctors is one doctor who Ellman describes as Dr. August. And he reports this protocol and the results in a 2-hour talk to a society, and I can't find the exact name of it, but it seemed to be something like the Society for the Study of Sterility and Infertility. And Dr. August describes this methodology and this protocol as, quote, the preferred technique for dealing with inorganic causes of sterility. Now, August reports, Dr. August, that in his own practice, and I just have to take the gentleman at his word, I haven't any means at the present time of confirming it, but I've got no reason to believe he's a liar, has an over 80% success rate, right? Without any drugs, without any of the ART type procedures today, just this very, very simple form of hypnosis. Now, one of the reasons that I believe in the veracity of Dr. August and his colleagues is quite simply they don't stand to any, there's no gain from this. There's nothing patentable here. You can't patent this procedure. You can't make any money from it. Perhaps you might build a reputation in your area. Perhaps you might publish a paper, possibly. But to my knowledge, you know, the names of Dr. August don't ring through the annals of medical history as a result of this. So they're not lying. They've got no reason to exaggerate. These are just a group of people, actually, who tend to be more on the skeptical side, who are just very, very glad to have found such an extraordinarily powerful tool. Now, this protocol is verified and practiced again and again and again and again with staggering success. And if it had been left at that, that alone would be marvellous, wonderful. But Ellman, being Ellman, my hero, is not satisfied. because he wants to know what happens to those 20% of cases where there's no conception, there's no pregnancy. Why? What goes on there? And so what he does is he begins going through a process of doing hypnoanalysis, as he calls it, the deeper process, beyond usually the skill level of some of the doctors, not all of them. Some of them do hypnoanalysis. If they get to a point where they're blocked or they feel it's beyond them, they refer it on, as I mentioned, to a psychiatrist, because that was what Ellman recommended and what the preferred protocol was then. But this is what he does. And I want to quote two cases. Now, here's a really interesting thing. One of the cases, the first case is, these are two of Ellman's cases, are with doctors, because he was with doctors. This is a doctor who, after he's done a training course and is one of his old students, invites him back, as he says, to have a midnight snack, and they go back. And this doctor, who's a 52-year-old gentleman, reports that using Ellman's protocol, he has had a 100% success rate with previously infertile couples with pregnancy. Now, again, I don't know if that's an exaggeration. Let's say it is. Let's say he didn't have 100%. Maybe he's just an enthusiast. Perhaps he only had 80%, but it doesn't matter. But here's the point. The point is, there's one person it's not working with, his own wife. He has a wife who is 32 years old, so they're 20 years apart. And both of them say to Ellman, with great earnestness, and I've got no reason to disbelieve, in the conscious mind state, that, and I quote, they want a baby more than anything in the world, but they can't conceive. And he says to Ellman, can you help me? And Ellman says, I don't know, but let me do some hypnoanalysis and finds out. So the first thing he does, and by the way, what I'm about to describe to you, none of this came out from any form of talk therapy. This was in the hypnotic state that this emerges. In the process that Ellman calls hypnoanalysis, which you've heard me describe, which is trying to get back to the reason why something's occurring. Now, I'm going to speak a little bit more about that in a second. But basically, it reveals this set of fixed ideas in the subconscious mind. This is in the wife. She says, I only feel like I'm half a wife to him, right? And because I only feel like half a wife to him, and I quote, I'll never let him make me pregnant, not in a million years. Now, why does she feel like half a wife to him? She believes that he believes that she can't love him because of the age gap. That because he's 20 years her senior, that she can't love him, he believes, in the way that she might love a man closer to her own age. In fact, he believes that she thinks the relationship is more like, almost like a father figure, which she absolutely fervently denies. It's his belief, we might say his insecurity. Now, that's not the only thing, because in a superficial way, most therapists go, oh, well, that's the reason, you see, that's why. That's the subconscious block. But Ellman goes further. He's very, very careful in what he does. He discovers that she's medically trained. He doesn't say what. I suspect she's not a doctor, maybe she's a nurse, because if she was a doctor, he'd probably say. But she's medically trained, and she really wants to work with her husband, as she sees Ellman work with his wife, of course, and other doctors work with their spouses, and she wants to work with her husband, but he absolutely refuses, because it's his belief that when a husband and wife work together in a medical practice, he's seen that that leads very frequently to divorce. And so he says to her, you can work with any other doctor you like, but you can't work with me, because he's frightened it's going to lead to divorce. And he's completely intransigent about this. And so she considers herself only half a wife, and because she's only half a wife to him, she's not going to let herself get pregnant. This is a subconscious program, an inner conflict over pregnancy. Now, to confirm this, or to see if this is even true, Ellman, quite correctly, does a hypnoanalysis on the husband. And again, I don't see this being done in any of the protocols being done today, with the exception of the ones that I'm offering. But I don't see it out there at all. Everything's focused on on the wife. So he does a hypnoanalysis on the protocol, and he finds that everything that she believes about what her husband believes, he confirms, right? And he says. And then Ellman goes through a process of trying to convince him. He says to the doctor, you know, you've been reading the wrong books on psychiatry, or maybe you haven't read enough books. And he says, you know, the 20-year age difference is nothing. There are plenty of couples with a 20-age difference, and they conceive and become pregnant. And your wife regards you as a fine figure of a man. She's very desirous of you. There's no reason. And he says all this in the hypnosis. But the doctor remains unconvinced. And again, I want to point out, for any of you that have any doubt, however powerful hypnosis is, it doesn't mean that you can convince somebody of something in the hypnotic state that they don't fundamentally believe. The doctor would not be persuaded. He didn't want to know, right? There's an inner conflict. And now, one of the things that I would have done and would do in the hypnosis, which Mr. Ellman didn't do, because he couldn't do everything and he didn't know about it, is I would go back with such a person to see what the emotional basis in the husband of that belief is. Where does that come from? Because the problem is not with the wife here. If the husband changes his belief entirely, and she feels like a complete wife, everything's going to change around. The inner conflict ceases. But where did he get these set of ideas? Now, in Ellman's style, it's all about insight. So it's a kind of an intellectual struggle at that point. But as you've probably heard me say, it's not all about the intellectual struggle only. It's also about what emotions are there. So I would have gone a little bit deeper. But the point is, and the most important point, that Ellman realizes that there is an inner conflict. And as he states, this inner conflict makes pregnancy impossible. Because, as you've heard me say on the last program, and the one before that, the subconscious mind affects, and controls the body. Here, we see, as far as we can know, a potent man and a healthy young woman who consciously want to have a baby and are presumably having sex at the right time. He's a doctor, he can understand when to have it, he understands ovulation cycles. They can't conceive. And from a hypnotic standpoint, the direct suggestions will not work because those inner conflicts must be resolved first before those direct suggestions can be effective. Because if there's a deeper subconscious program that's acting as a block or protection mechanism, then the direct suggestion is going to just bounce off like water off a Teflon pan. It just won't work. And that's why weak forms of hypnosis, weak forms that A, don't involve true somnambulism, and forms that never do any true hypnoanalysis but just a creative visualization and suggestion, whether direct or indirect, however imaginative, are going to not be effective when there is an unresolved inner emotional conflict. You have to go to something deeper. Let's take the second case that Ellman talks about. Another doctor, and the doctor and his wife have a 9-year-old son. They're a fairly young couple. They've been trying for 9 years, according to Ellman and the doctor, to have a second son. And again, they both state that they really, really want to have a baby. That's the conscious mind view. Now, again, he does hypnoanalysis on both, this time on the man first. He finds the man, no problem. There's nothing holding back. In other words, there's no subconscious block, there's no inner conflict. He wants to have a child, he's happy to have a child, he's good. Now, when he does the hypnoanalysis with the wife, he finds something quite different. It turns out that these were, when they were both at college together, they were both high profile. She was as he describes it in the 1950s way, the belle of the campus, and her later to be husband was the hero. You know, so I don't know what that meant, but anyway, two key figures. And then this is what comes out, and I quote in the hypnoanalysis. By the way, they kept company for 2 years together. I guess that means they dated, and then they got married. But she says in the hypnoanalysis, and I quote, "Oh, Mr. Ellman, he seduced me." And I'm going to infer by this that it means beyond seduce in the sense that we meant. It probably means close to rape. But He seduced me. The first time I had anything to do with him, I was just an innocent girl, and I got pregnant the first time. And if he thinks he's going to get me pregnant again, he's very much mistaken. We had to get married. And if he thinks he's ever going to get me pregnant again, he's very much mistaken. Again, this comes out in the hypnoanalysis. So here, this conflict is literally making this couple resistant to pregnancy. Now, you might say, oh, how is that possible? But we've already described in detail how the subconscious mind affects the body. So, in some shape or form, the subconscious mind is affecting her body that it will not let her conceive. Even though she states she wants it consciously, and I've no reason to believe that she was lying about that, subconsciously there is an inner conflict. And the key thing that Ellman finds is that inner conflict makes pregnancy impossible. Impossible, he says. So what to do? Well, in some of these cases, he's able to resolve that inner conflict with the person. Now, he doesn't mention, in these two cases, and this is again, I love Ellman for this, he's never afraid to talk about his failures, because for him failure is instructive, as it is for all of us. He does not manage to resolve these inner conflicts. And as long as these inner conflicts continue, neither couple conceives. However, in cases where he is, and some of his doctors and others are able to resolve these inner conflicts, something entirely changes. And there is a possibility of conception. And he reports how one of his students, who is a psychiatrist, who also used hypnotic technique, is able to consistently work with the clients, his patients as a psychiatrist, to resolve these inner conflicts. And in resolving these inner conflicts, these people are able to conceive. So in fact, when you add the, as Ellman calls it, the hypnoanalysis, the deep subconscious work, to what the protocol, you've got a success rate above 80%, 90% and even more. And again, extraordinary result. Now, I have many comments on this. The first is, I want to point out how much more sophisticated and insightful this is than everything that's just about stress. All the things that we talked about before, just mention stress. If you just relax enough, this goes way beyond that. Their insights were much deeper than our insights. Ours, in the modern age, are superficial by comparison. And with the great respect to Mr. Schwartz and the work that he's done, and the other people who are only focused on stress, there's a lot more to it than that. If they're only focused on stress and stress relief, they're never going to get down to the deeper causes, and they're never going to be as effective as Mr. Ellman was, and his colleagues and his students. They are never going to get the success rate that he has if they don't ensure that they're using powerful hypnotic technique. So you need powerful hypnotic technique, and you need something that's not just stress relief if you want to get these results. Now, I believe that the protocols that I'm using, standing on the shoulders of the great, like Ellman, and the wonderful doctors and intelligent people that work with him, I believe that it's possible to make some improvements. And here's how. It's apparent to me, as I've said many times, that when there's a strong subconscious program and inner conflict operating, which has a strong emotional basis, direct suggestion will be rejected. Now, the reason Ellman suggests direct suggestion first is because he's giving the doctors a simple, straightforward protocol that's still going to be effective many, many, many times. That's the first port of call. They haven't got the time necessarily to do, they're seeing patients all the time. They haven't got the time to do what I do, spend 2-3 hours with somebody trying to get to a subconscious cause. That's not what they're there to do. So they work a different way around. They do this this hypnosis, and for the 20% that can't, they refer them off to a psychiatrist if they can't get anywhere with their own hypnoanalysis, and most of them are not skilled enough to do it. So that's understandable, but I and the people that I've trained and worked with, we're in a completely different position. We do this full time. So what I do is when I work with somebody, the first thing I do is do what Elman called the hypnoanalysis. Now, what I do, following the training that I received, specifically from the work of Jerry Kine, but specifically Stephen Parkhill, who I've mentioned before, is we have processes for digging deep into the subconscious mind. And what we recognise, which Mr. Elman didn't recognise at the time because he's still a man of the 40s and 50s and early 60s, is that insight in and of itself is not enough. In fact, in the two cases that he mentions, it's clear to me that what needs to happen is there's strong emotional programs and there needs to be emotional release. Following emotional release, the insight then changes the fixed idea. So, the first thing that I do in my protocols is to find out if there are any emotional programs in the male or the female which are preventing pregnancy. That's the first thing, because there's no point in me giving the direct suggestions until I know that the pathway is clear, that the ground is fertile, as it were, for those direct suggestions to seed and flower, or germinate and flower, right? So that's the first thing. But again, unlike most of the protocols that the people I mentioned before conduct, I work with the man and the woman. I want them both to participate. Of course, where there is a man and a woman, again, unlike the 1950s, of course, people are going to come to me and they want to conceive. I know of one lady that came, she didn't even have a partner, but she wanted to have a child. And so she went through a reproductive process using in vitro fertilization. And again, we're not about judging whether she's right or wrong. That's not the point. The point is obviously with her, there isn't anybody else for me to work with, so I just work with her. But that would be my first thing. Now, like Elman, unlike some of these protocols here, we're going to be doing several cycles. We're going to be matching that to the time of women's ovulation. Again, I prefer to see at least 3 cycles. There's no reason why people can't do, if necessary, 4 cycles or 5 cycles. The reason Elman mentions only 3 is that they basically determined if it's not going to happen after 3, it's not going to happen. And that's probably true. But very often, the other reason they don't need to do more than 3 is it's not necessary to do more than 3. It doesn't occur. And again, only using that simple protocol. In the protocol that I'm using, we're going to be doing that hypnoanalysis, as he calls it, or healing hypnosis by regression to cause, and direct suggestion. We're going to be doing both in that. The other thing, of course, is that we have much, much more accurate measures now of measuring ovulation, so that improves our protocol. And we also know, I believe, more about nutrition that helps in conception and fertility. Again, this is not the place to quote all the studies and things that are there, but there are many protocols which have no downsides at all, in which simple nutrition in the form of supplementary vitamins and minerals help. They increase the likelihood. So again, an improvement on the process. And then, of course, after conception, it's very important that we hypnotically, and by which I mean hypnotically, emotionally support the pregnancy. Obviously, at that point, it's not necessary for me to do any work with the husband, because there's nothing I can much really say to him that's going to help support that pregnancy. But I can do that with the woman. And so what that means is not only are we helping conception, we are clearing the emotional blocks, we're giving powerful direct suggestion, but we're supporting the pregnancy, particularly through the early stages. Those crucial stages from the first time the pregnancy is detected right up until the 28th week, or at least past the 16th week, at least past the 20th week. Because we want, assuming it's a healthy pregnancy and assuming that after all the medical tests are done, that the couple want to have this baby, that the pregnancy continues and that the pregnancy is as easy as possible. By easy, I mean minimising the effects of sickness or vomiting or any other effects of the pregnancy. Because, as was mentioned in the other studies, even when a weaker form of mind-body work is done, weaker than the form that I'm describing here, the pregnancies are easier, the births have fewer complications, the labours are shorter. So we support all of that. And here's another thing. If doing all of these procedures, and I would strongly recommend for anybody considering ART, having listened to this, that they at least try with the procedures that I'm describing first, since they're non-invasive and a great deal cheaper than probably even one cycle, I'm sure cheaper than just one cycle of in vitro fertilisation or other reproductive therapies, that they at least give this a shot. But let's say they're not completely convinced or they want to cover all the bases and they do ART, then all of the studies that I quoted before indicate that they're greatly going to be able to improve their chances of being successful with ART. So whether you use assisted reproductive therapies or not, you're going to increase the likelihood of conceiving a trouble-free pregnancy and an easy birth. And then, of course, I hope that they would choose one of my pain-free birthing programs, but they don't have to. And so this is what the program that I'm doing with the people who come to me look like. And I'm so excited about the results and what can happen that I'm going to make it my focus to really expand this program over the course of the next few years. I want it to be more widely known about, because it's a crying shame that something that's so simple, something that's so healthy, something that's so non-invasive and so powerful is not more widely known due to, I'm sorry to say, ignorance in the hypnotic community, ignorance in the therapeutic community, and ignorance in the medical community. That's part of what this program and these things are about, to help inform. So, that's what I believe is the most powerful and effective fertility hypnosis program that's currently out there. I don't know of any other one that's more powerful and uses more of these powerful tools. So I'm hoping that anybody out there will find me and contact me, even to gather more information. I hope this information has been useful to you. I hope it's been a revelation and something that you can take, question, do your own investigation, and I hope use, because it's so powerful, it's so simple, it's so effective, it's so low cost as well by comparison to the alternatives. So thank you very much for watching this edition of Hypnosis Helps. These last three all focused on hypnosis and fertility. And until the next one, thanks for watching. See you next time, and let hypnosis help you.